actual tooth. The thing is, with a painting kit out and stuff, putting blue, white, grey, it's just things that you're going to experience are they're going to look really white during the process. Yes. Yeah.
Putting the frame at the top and then you're into two.
Hi, my name's Adela. We're in Banning, Wembley. So I'm going to get some composite bonding done today. So I've done a lot of research into it, and it's something that I want to do to help just enhance my overall look. So I'm really excited for the overall procedure. Hopefully it all goes well. I'm going to get 10 teeth today. So overall, I'm okay with the shaping. So I want like a natural look, but I just have this gap at the side of my tooth and a little bit of a white mark on my tooth that I've had since I was little. So that's one thing that I'm just insecure about. And I've spoken to a few dentists and they were like, that is something that can be corrected with bonding. So hopefully that's what I'm trying to get out of today. Today I'm going to see Dr. Khalil. So I've done a lot of research on Instagram and I just find that his approach is really natural. It doesn't look like you've got like a whole set of fake teeth. He really like listens to the patient, and I've seen like on his page there's like different types of styles that he's done. He was really kind and he was really approachable. So I thought, you know what, I feel comfortable enough for him to do my teeth and I'm really excited for him to go ahead.
It's Khalil. So today we were doing the live demo of freehand composite veneers, and we decided to basically go through from literally step one to the end of how I do composite bonding. Everything from like the consultation to, speaking to the patient to selecting shade, shapes, everything. So yeah, it was a very useful jam-packed day. I think that a lot of the delegates had similar problems that they were facing, and it was the same problems that I was having when I first started composite bonding. So it would be things like, line angles, how to do embrasures, selecting shade, thickness, looking at occlusion. So we covered all of those topics today. I also made sure that all the delegates could see what I was doing, because I feel like sometimes when you go on these type of live courses that it can be quite difficult to see what the clinician's doing. So we made sure we made it like a quite small, intimate group so everyone could see what was going on and everyone, could ask questions. If you need to step out, you can. Yeah, I was very happy with the final result. With composite bonding, it's always a change for the patient. So that's what we're kind of drilling in today, that, it's normal for patients to sometimes feel surprised when they get it, but it's all about reassuring them. And communication does play a huge role in that aspect of managing expectations. But yeah, the pictures speak for themselves. People you will be used to feeling. It's going to feel weird to talk as well because certain teeth have become a bit longer. Yeah. So the way your tongue hits your teeth.
Oh my God, so good. Like, I just can't stop smiling.
Oh, it looks so good. Oh my God, I love it.
I think the fact that it was an instant reaction, like I could see it straight away. I didn't have to wait like a little while later to see what the actual progress was going to be. So the fact that after this 2-hour appointment, it's gone from like 0 to 100, like it's amazing. Like, can't deal. I literally thought, I can't, is that actually like mine? Like, it just felt unreal. So I know a lot of people would say that it's like a cliche kind of thing, but it genuinely, it just instantly gave me a confidence boost, especially the 2 teeth that I just wanted to rectify. It just instantly, it just made me feel so much more confident. Just to show my family, to be honest. I just said to Dr. Khalil, I can't wait to show my husband. Like, it just feels really, really nice. And especially with my line of work, I'm in front of a lot of patients as well. So I'll feel a lot more confident, like talking and like just genuinely being socializing more. I feel really excited. Not at all, actually. Like I thought there might be a bit of like an injection or something when he needed to do the actual bonding, but it was completely pain-free. Like I didn't feel anything at all. Yeah, it was really good.
Would you recommend this treatment?
Yes, 100%. Especially if you're looking to get something with a quick like confidence boost and a quick turnaround. 100% bonding, I think, is really, really good. Yeah.
And any kind words for Dr. Khalil?
He was amazing, really thorough, and I was a little bit concerned halfway through, but he completely reassured me, and I just feel really happy overall with the whole result. yeah, it was really professional. Really recommend him.
So yeah, if you're looking to, upskill on your sort of composite bonding technique or, communication, whatever it is, come on to the next live demo course. I'm going to be doing one of my best friends next. So yeah, it should be a good one.